Welcome back, everybody. This could really be a game changer for folks who suffer from migraines, and that is a lot of people. Estimated at nearly 38 million people in the United States suffer from these horrible, horrible headaches. Here to talk about a new era in treatment of migraines is Dr. Brian Grosberg, who launched the Hartford HealthCare Headache Center. Welcome. Thank you for being here.
Thank you for having me. I appreciate it.
So this is really going to be some good news for folks, because we know that migraines can be debilitating to the point that it just kind of shuts you down for the day, right? So tell us about the new treatment.
So the recent FDA approval of this migraine-specific preventive medication, this is the first of its kind that's ever been developed. So it really raises the potential to cause a paradigm shift in the way headache specialists like myself and others treat people who are suffering from migraines. We
were talking about the way that it's been treated before. There's not really been a dedicated migraine medicine, right? Most of the treatments for other things, like high blood pressure, you could use Botox,
That's
stuff
correct.
like that.
None of the medications that we currently use to help prevent migraines was specifically designed for headache prevention.
And how does this work? Is it an injection? Is it a pill form?
So it's a monthly injection, and it's a self-injector, so patients inject themselves monthly.
Gotcha. We had a coworker, Ann Craig, used to work with us, and she used to anchor in the evening, and she suffered from migraines, and she did a few stories, and it's really eye-opening just how severe the pain is. Would this treatment help to lessen the severity of the migraine so you could actually, accomplish some things instead of spending pretty much the whole day in bed, which a lot of folks end up doing, right?
Yes. So this treatment, even though it's a breakthrough, it's not a panacea, right? So it's not cure, but it's a definite progress in the treatments that we have. And for people who may not have responded or who are looking for migraine-specific medications, this certainly can be a game changer.
Yeah, definitely. And I think folks who know the pain of migraines will hear that and say, okay, how do I find out some more information? And how would it work as far as opportunities to get it, cost, maybe insurance, things like that?
Sure. So they would call the Hartford HealthCare Headache Center and be seen as a patient, and that's one of the treatments that can be offered right now.
Okay. And you mentioned also that the FDA is working on other drugs that might be able to help with migraines. So this is a new era in treating migraines, which is really good news.
Excellent.
So there's a lot happening?
Yes, there's a tremendous pipeline. So this is the first of 4 medications in this class of what are called CGRP monoclonal antibodies that are specific and mechanism-based to help prevent migraine.
Okay, so just one more time for the folks who are thinking, okay, sign me up. What can I do? I'll do anything at this point. Oh, and let's just talk about side effects. What have you seen with those?
So the side effect profile is actually pretty benign. Okay. Aside from some injection site reaction, most of them are usually well tolerated. So that's actually an exciting thing too, because some of the medications that people are taking today, they may have some side effects too.
Yeah, it seems like some of the medications, the side effects are worse than what you're originally treating it for.
Yes.
Okay, let's get all the information out there for folks over at your center.
Sure. So they can call the Hartford HealthCare Headache Center, or they can email us and come be a patient. And this is one of the treatments, amongst others, that we can talk with patients about.
And they can get going pretty much right away?
Right away.
Excellent. All right. Dr. Brian Grosberg, thank you so much for coming by.
Thank you so much for having me.
All right, good to have you.